First, we found out that the number of people seeking health care for, say, a heart attack or a stroke appears to be going down at local hospitals.
And health professionals in Clark County are concerned people aren't seeking life-saving care because they're afraid of coronavirus. Jennifer Dowling live with a message from those health professionals. Jennifer?
That's right, Jeff and Jennifer. If you're feeling shortness of breath, chest pains, or any signs of a heart attack or a stroke, medical professionals want you to seek that emergency care. They say hospitals right now are not overwhelmed because everyone's done such a good job of social distancing and they have procedures in place to keep you safe.
The big fear is that people are waiting these out at home.
When it comes to a heart attack or stroke, a few hours or minutes can mean the difference between life or death.
Really, minutes and hours really makes the difference in the long term.
Dr. Ben John of Vancouver Clinic says a letter in the New England Journal of Medicine shows that healthcare providers are noticing a drop in visits for life-saving care nationwide.
I definitely think there's a fear.
In fact, Clark County public health officials put out an official statement urging people to seek emergency care when necessary, adding local ERs are fully operational and are taking the precautions needed to safely see patients with non-COVID-19 emergencies.
There's much more attention to early isolation of suspected cases and literally separating individuals into respiratory wards and those that are coming in with non-respiratory complaints going to different wards.
Dr. Jason Hanley is the director of the ER at Peace Health.
When you have a heart attack and the heart attack progresses over a number of hours or days, it damages the muscle of the heart permanently, and that can lead to lifelong problems.
He says strokes should ideally be treated within 3 hours. He says some patients have come in and waited so long it negatively impacted their long-term health.
By far, the most dangerous thing you can do is to stay home.
And Dr. Hanley says that everyone who comes into the ER is given a mask and they're asked to wash their hands. They're also socially distanced appropriately so that you can stay safe. So make sure if you're having those issues to go in right away. He says the U.S. is not the only place that's seeing this issue. He says it's happening in Europe as well. Back to you, Jeff and Jennifer.
Jennifer Dowling live for us tonight. Thank you.